and today we are going to be focusing on corporate communication. We mentioned this particular concept yesterday in one of the slides, but now today we are going to get into more details so that we can now be able to understand it even better, and we can now be able to clarify from yesterday's discussion. So I invite all of you. Remember, we have this session recorded, so keep your mics on mute so that we can be able to proceed together. So the term corporate communication is key in terms of matters communication, and it simply means the interactions and the relationships that each organization is going to be able to create with a number of audiences. So that's why we are using the term corporate now, because we have expanded this particular communication to reach many people, diverse audiences. And then once we do that, the aim is to be able to achieve certain planned objectives for the organization. And it's also a form of strategic public relations. Remember, we had a lecture where we emphasized on public relations. So corporate communication is just a form of a strategic, or a form of what we are calling public relations. Now, we have different characteristics of corporate communication. These could also be features. Number one is that it primarily targets non-consumer stakeholders, directing its efforts towards various publics and stakeholders beyond consumers. So when we are doing corporate communication, we are going far, and we are going to communicate with very many other audiences and our consumers only, consumers of our products, if it's an healthcare organization or if it's any other kind of an organization. So we are saying the key target is non-consumer stakeholders. So that means everybody else is included in that particular bucket. And then we are also saying that it is significantly emphasizes building positive relationships. So the key idea for going the route of corporate communication, we also want to build positive relationships, and we also want to build trust with stakeholders. And yesterday we had, or the previous lecture, we had a long discussion around reputation management. So that characteristic is that we intend to, through that, to be able to work on our reputation, manage relationships, which is very, very key for corporate communication. And finally, we are saying it is integrated across all stakeholders. Yeah, so every stakeholder is key, whether we are referring to the consumers and the non-consumers. We intend to have corporate communication playing a very, very critical role for our organization. Now, what objectives do we intend to have when we are doing corporate communication? What is the purpose? Why are we talking about speaking and consumers? Why are we expanding the base of the people that we intend our communication to be able to reach? Number one, which we have repeatedly talked about, we want to build a foundation of trust. We want these people to believe in what we do as an healthcare organization or any other kind of organization. And remember, the consequences or the effects of an established trust is that you are able to have your very own loyal clients, loyal patients, because there is something from your organization that they know you have that is to stand out, or a size that you offer to them that they know it is best. The other one is we want to cultivate engaged relationships. So we want to build relationships that are going to last when you're doing corporate communication. It's not a one-off thing that we are going to be doing. So we want to have lasting relationships. So the key emphasis when we want to have lasting relationships, we will now focus on having two-way communications. Two-way communication means the organization can communicate, and also the people that the communication is intended can also communicate back. And you are going to be seeing examples of that. And then also this kind of communication will also encourage both speaking and listening. That's very important for both parties. The organization, there is that time that they have to listen. Maybe we have complaints from our clients, from our partners. We need to respond positively. I did also emphasize that on our previous lecture. And also we are saying corporate communication also involves a mix of push and pull communication strategies. Now, when we talk about push communication strategy, it is that kind of a strategy that comes from the organization perspective, where they proactively deliver their message to the target audience. So we are calling it push because it comes from the side of organization, then they push it to the intended audience. Yeah, so the part of pushing is push for information, push for products, push for services directly to the audience. And mostly when we are looking at the push strategy, it could be a one-way strategy. It is more organization-centered towards external audience. A perfect example of what we call push communication strategy is when organizations put their adverts on TV, commercials, on print media, and they are willing to sacrifice even resources, finances, for a particular information to be able to reach the intended audience. So that is push kind of communication. It's from the organization to the public. Examples of institutions that practice push kind of communication, we have organizations like health ministries in different countries. Anytime maybe they are pushing some type of vaccination during the period for COVID-19 that we were mentioning yesterday, they also adopted this kind of a strategy to be able to push information out in regards to COVID-19, preventive measures, the numbers of people that have been affected, how many have died. And we also have other organizations, like we mentioned previously, the WHO. They're also keen to push this information out. We gave the example when we were talking about COVID-19 and what they were doing during that particular season. We also have another organization that I had also quoted, the Center for Disease Control. Lots of information on their website, and they also provide health guidance. So all that is push communication strategy. When you talk about pull communication strategy, this uses what we call an inbound approach. So organizations are able to create content that is going to attract the audience or create the interest of the audience. So once that content has been released, the audience will be interested in it, seek information about it. Maybe it was information around some treatment that is going to be happening. Maybe we are running a medical camp. So they will just do a small advert. Then people now are going to call in, find out more about the medical camp. Maybe there is some information that has been left out. So once they find out about the medical camp, they can be able to do inquiries. So the pull one is more of a two-way communication. And some of the examples that we can call about the pull communication strategies are are social media interactions. Those ones are key. You will always, I did send you to some social media pages. You will always see a comment by an organization. Then people are making inquiries. When is the date of the clinic? How much are the charges? Where are you located? Yeah. So for them, the organization just put the advert. Then because they are using the pool communication strategy, people respond by asking questions. Yeah. So it is interactive. The pool one is more interactive, and like I've said, it's a two-way communication. And examples of institutions that are doing that from our previous lecture, the last slide, we talked about the Mayo Clinic. So they specialize, or they focus more on providing health information. We could also have what we call patients advocacy websites, like the American Cancer Society. So those websites are just there for people to get information. So those objectives are key in terms of corporate communication. Now, elements of corporate communication. Yeah, so this is like saying, what does corporate communication involve? Yeah, so it involves, number one, marketing. And when we talk about marketing, we are simply referring to a set of activities that involve identifying and satisfying customer needs. So the purpose of marketing, of course, is to be able to create and deliver value to customers. And in marketing, we also focus in doing market research. We also focus in doing product development. We also focus in coming up with pricing strategies, and so on and so forth. So that one is a major element in corporate communication that we may not be able to avoid. Then the other one is advertising. The key focus here now is to be able to provide communication and promotion of products and services or brands to various audiences. And the key purpose of advertising is awareness creation, passing information in a persuasive manner, and also the ability to be able to remind the audience about a specific product in the market. So the other one is media relations. It is very, very important for all organizations to create a relationship with the media. And the purpose is just to maintain a cordial working partnership. And one way of also making sure that organizations and media continually interact, from the side of organizations, they would continually release what we call press releases. These are just formal statements where you don't need to call the press to come to your office. You just write a formal statement of communicating the start of a particular vaccination. Then you send it to media houses. That's part of creating media relations. And also, part of the relationship, we can also encompass media interviews. We can bring on board the aspect of media interviews, and also we can also bring on board the aspect of social media engagements as part of media relations. The other one is crisis communication, also very well emphasized on our previous lecture. And we said that the key focus is to address any kind of crisis that might occur promptly. So when we are addressing any crisis through corporate communication, then we are telling people about preparedness. We are telling the public about rapid response. And through that, we can also have a spokesperson. I did emphasize on that and said the reason for having a spokesperson is to have one source of information. Yeah, so that one is very, very important. And finally is on public relations. And we also had a discussion on public relations. And we said the key idea or the key purpose of public relations is to manage and shape the perception of organizations in the eyes of the public. So public relations is ensuring that the public always see us on a positive note. So any rumors that are coming from our healthcare organization or any other kind of an organization that is not good for the organization. So it is the role of public relations departments, organizations that have public relation offices to come out and give their side of the story. And we said when they are on the wrong side, we need to be able to apologize and move on from those particular issues. Um, very importantly, we will also discuss what we call marketing communication. And we are saying the key focus of marketing communication is the selling of specific products and services. So marketing communication is consumer oriented. By this we mean that when any organization is consumer oriented, then we are looking at meeting individual needs, preferences, expectations. And one way of ensuring that we are doing marketing communication that is consumer oriented, we can, for example, have what we call tailored messaging, where you craft a message that is tailored for specific people. Let's say, for example, you are doing an advert on diabetes. Of course, not everyone is suffering from the disease, but also they could learn from it. But the key people are those that already have the diabetes. Maybe you could be having a short video discussing on the nutritional areas or the foods that these people need to eat. So that's a method of marketing communication that is consumer oriented. Then we are also saying marketing communication also utilizes specific predefined media channels. The predefined media channels would also be those that are very well defined, the TVs, the radio, the print media, and so on and so forth. And then in marketing communication, we also employ controlled communication tactics. So controlled communication tactics are simply the channels which an organization has a high degree of control. Those, we are calling them controlled communication tactics because it is you who has a high degree of control over the messaging and distribution of any information. For example, organization websites. The websites are in complete control of your healthcare organization. So any information that you put out there, nobody can be able to maybe delete it because it's controlled. You own the website. And we could also have organization or social media platforms. We could also call them controlled communication tactics. And we could also have what we call email marketing as examples of what we call controlled communication tactics. And then also, as part of marketing communication, we can also do positioning of individual products and services or brands. And when you are positioning a product, we are simply saying they are just a way we are going to have our products being perceived in the customers' minds, and have the customers being able to differentiate from competitors. And then we can also do positioning of individual products. How can we ensure now when people think about a certain product, how comes they think of a specific healthcare facility or healthcare organization to be able to receive that particular good or service? Organizations can be able to position themselves by looking at what we call price leadership. So they are going to be focusing on being the most affordable in the market. And they could also produce goods that have superior quality. And also they could also target a specific audience. So that one is very important. That one is key. And then also create freedom when we are talking about creating freedom or allowing more people to create freedom, uh, it simply means that there is liberty in terms of generating ideas. So when we are practicing marketing communication, the team that we are working with, we should give them a leeway to give their views, their suggestions, uh, have a freedom of expression, and so on and so forth. And lastly, is that in marketing communication, we also need to have consistency with products, brands. There is, from our previous lecture, we were mentioning about the issue of consistency and what we need to do so that we remain consistent. Now, internal audiences in corporate communication, we said we have the push, the pull. So we could have internal audiences that could also benefit from any of these communication or corporate communication. Number one are the employees. Those are very key internal and important employees, or a group of people that are going to benefit from corporate communication or messages being sent out by corporates. Then we have stakeholders. So they're also very, very key. Remember, we said stakeholders are people that have interest in the organization. They could be internal and also external. And in an healthcare facility, we could be able to talk about stakeholders in the name of patients, in the name of donors. Maybe we receive funding also from government. All those are stakeholders. And finally, another very internal audience, a very important group, is what we call the stockholders or the shareholders. So shareholders are just what we call a share simply is a unit of ownership. So when we talk about shareholders, we could be running a healthcare organization that is owned by certain individuals. Those are the shareholders. And they would also be keen to receive different forms of information in regards to the organization. Now, on the external audiences in corporate communication, we have the media. The media is key. We have mentioned it quite a number of times. We also have various kinds of agencies. Examples of those agencies would be regulatory authorities, NGOs, various industrial associations. Those ones are very, very key. And also, other people that would receive information through corporate communication would be government. And we have the general public. Those are just the citizenry. And also we have the channel and industry partners. So when we talk about channel partners, we could be thinking about resellers and distributors of our products as an healthcare organization. We could also be able to think about the people that we call affiliate partners. These are people that will be keen to promote our products and maybe earn commissions from it. And then when we talk about industry partners, we could be referring to trade associations, research and development partners. All those are key people when it comes to being part and parcel of the external audience. Now, we have what we call the elements of healthcare corporate communication. So corporate communication involves a number of things. Number one, it could be corporate branding elements. So in terms of our logos, in terms of our fonts, as an organization, we need to be very keen. I have also seen organizations putting even adverts to request people to do logos. and the person that has the best logo will qualify for an award of some certain financial benefit. So they are key when we are doing our adverts. What kind of font are we using? Colors, very very important also. Once you hear about Bristol University, you know we could have various colors: green, red. You know their logo. Uh, you know the wordings that are there in terms of wisdom to tread new paths. So all organizations need to have something catchy. Mm. As we send out any information, then our logos, our fonts are going to be key for us. Typefaces are, when you talk about typefaces, they are just a set of letters and numbers that an organization would decide to adopt. Like what we call the font family, where we have regular styles, italic, bold styles. Those are typefaces. They are just characters or letters, numbers, or symbols that an organization would decide to adopt. Then also when it comes to stationery materials like letterhead, now every time you visit Bristol University for any communication, the communication is done on what we call a letterhead. That distinguishes your communication from any other communication. Uh, why don't they just print on a plain paper? Because in terms of corporate communication, that is not right. If it's an official letter, then the letterhead becomes key. Letterhead is just a plain paper, but within it, it has been inscribed the name of the organization. Mm. So it is key. Then we could also have visiting cards, bills, memos that bear the organization's branding. That's part of corporate communication. You can send out notebooks that are branded, visiting cards, bills. I mean, everything just needs to be branded in terms of stationery. And also another key element in healthcare corporate communication, we need to conduct the code of conduct. These ones are just guidelines and policies governing employee behavior. Every organization, of course, have what we call the codes of conduct or the code of conduct. They exist to govern how we are going to operate. Just like in any online session, one of the rules, major rules, is to keep our mics off. Uh, so in an organization setup, a code of conduct stipulates the rules and regulations that everybody should be able to adhere with. Now, other elements would be email etiquette. I'm sure the institution has invested in training you in terms of email etiquette, proper protocols and practices for communication via email. Uh, what kind of a tone are you using? That's very key also as part of corporate communication. And also communication template. We could have pre-designed formats of various types of healthcare communication. And also very, very important is the issue of branding and reputation management. So that should be key for us in terms of branding. And that's why the choice of organization colors really matters. How we take care of our reputation is also key and very, very important. We did discuss that on our previous lecture and emphasized on the need to always create a positive brand image and perception in the industry that we are in, or in the healthcare industry. Other elements, so we have talked about email marketing. So other elements could be, these ones are still of healthcare corporate communication. We could have what we call corporate collaterals, and these are simply printed materials like brochures and flyers for healthcare marketing. And also these brochures are keen to use for information dissemination. And also another element is what we call corporate events and patient relations initiatives. So we can run events. We could run events that are meant to create awareness. It could be seminars within the community. Those are corporate events. It could be medical camps if you are talking about a healthcare organization. It is simply a way of telling people, the public, the community, that hey, we are around, this is what we do. So you take that particular opportunity to be able to pass any information that you need. And finally, we have what we call facility signage. Mm. So this one is simply to show people that this is our location. So you could do as big as you want, but we would emphasize on the visibility, or the ability for the signage to be very well visible. So where have you placed it? And that's why you see most institutions will place it along the roads that anyone can read. They should not be hidden, because the key purpose is to send the information out there that we are existent. Now we have what we call the healthcare communication process. And communication is simply the way that we are going to be conveying healthcare related messages to various stakeholders. And this process does not change. Just like it is discussed in a communication session, the same case here, we need to have the source. And this is the organization that is going to be delivering the message. And then once we know the organization, if it is ourselves or if it is organization X, now we go ahead and find out what is the message. Remember, if you are doing a TV commercial, of course, like we said, there is a cost involved. So you could not be looking for a commercial that is 1 hour. Why are commercials even less than 2 minutes? It's because we focus on the key information. If we are advertising a medical camp, we would talk about the location, the time, the day. Those are key things that we cannot afford to miss. So what is the message? I was interacting with another media person. They were doing a certain story, and they were telling me even to get 2 minutes of primetime news as a short story, it's not something simple. Mm. Mostly they will, all these stories that we watch on our TVs, especially during the news hours, they will be 1 minute, 1 minute and some few minutes, depending on the magnitude. So what about an advert? Uh, we also need to be very considerate. Of course, the longer it is, the more it will become very costly. So as you are sitting down to craft your message as the source or the organization that is delivering the message, you need to ask yourself, what is the most important information? Then you can craft something of that nature. The other one is the receiver, the individual or group receiving and interpreting the message. So who is your target audience? That's what we are emphasizing, or talking about the receive. Who is your target audience? So this is the person who is receiving the message. That's very, very important to be able to note. And also we have something we call encoding. So this is where we transform healthcare ideas or messages into symbols. Now, every message that you are crafting will of course begin with an idea. So once that idea has come into your mind, then it is very, very important to now put it down into an actual message. So that particular process is what we are referring to S encoding, and it is very, very important to be able to note that particular point. And then also we have what we call decoding. This is where we interpret healthcare messages based on various symbols and languages used. So in every message communicated, then we are expecting the receiver to interpret, understand. Remember, once you are not able to decode right, then you will not be able to give proper feedback. So you are invited to, once you receive any communication from an healthcare organization, for the target audience also, they need to sit down and internalize, or it is also keen for you to identify simple language that you can be able to use, that individuals can be able to understand. If you are sending information to the most remote part in your country, for example, you need to do research and identify which is the best media that we are going to use. Now, uh, when we now are releasing or disseminating this information, we need a number of channels, and these are channels that will be used to deliver the messages. And we have, for example, what we call the mass media. Um, we also have the digital media, or we can also use the billboards. I'm sure these are very common aspects within your organization, or you have heard about them. Mm. Now we will also look at healthcare corporate communication strategy framework, or what is it that we need to be able to do. Number one is determine the most effective communication channel for healthcare messages. We have just mentioned the channels here. So which is the most effective for you? That's a determination that you make. And then also we could also structure or structuring healthcare messages effectively. Like I said, once you get to know your target audience, then you are able to know how you are going to craft the message, and also understand the attitudes of healthcare constituencies, e.g. patients, medical staff towards the healthcare organization. That's all about perception. The people that you are sending information to, what do they think about yourself? Sometimes people see adverts and just give a negative comment. Maybe they had a negative story about this organization. Uh, like you go to some countries and you find there is a bank, for example, that has a bad name, or that has maybe messed around with people's customers. So when you are walking around, or when you are in a forum, you will always hear the bank being mentioned. Maybe you are discussing of an account that you would want to open as a group, and guys will say, hey, don't try that bank. Maybe they have not had a personal experience with the bank, but they have had information from uh, an external source. So as we are crafting the message, we need to think about the attitude of the people that we are targeting. And then also we need to assess the available healthcare resources. Of course, to do corporate communication, you need finances. You need personnel that know how to go about it. You also need time as a resource. So you need to assess what is available. And the other one is evaluating the healthcare organization reputation. So we have had a discussion around reputation very, very much. So we need to check on that. Now, key considerations for the healthcare sender. Remember, this one is coming from the communication that we have just mentioned here, the healthcare communication process. So we are talking about the key considerations. Number one, that the source or the sender needs to do. They need to identify desired actions from different healthcare constituencies. For example, investors, patients, media. and so on and so forth. And also they need also to assess the resources available for healthcare message delivery as a sender or a source. If you I've just mentioned about time and budget, and also human resource that understand corporate communication. So if you do not have the resources, uh, like they are listed here, it means now you are limited in terms of what you can do. And also monitoring and managing the healthcare organization reputation in the healthcare industry. So we need also to be following up on what is happening in terms of reputation. It's very very important as we send the information out to get to be aware of that. Then how do we go ahead and structure healthcare messages effectively? Mm. We could have different ways to do it. Maybe we could adopt a direct way of doing it, where we focus on giving a main point first, and then we bring our supporting reasons. Yeah, that is key for every organization to be able to do. Yeah. So, what is the main agenda of the communication that we are sending out? Mm. If it is a medical camp that we are inviting people, the main clause in the advert should be the medical camp. And that's why you see sometimes even when we are doing adverts in print media, the main words we put them in very presentable and appeasing colors, because that's the key point that we want to emphasize. Then we have indirect. Begin with the reasons or the context before revealing the main point. So in indirect, you don't focus on the main point. That will come later. So you focus on telling people the reason of maybe of conducting the medical camp, so that they see a need to come to the camp. Yeah, and then a main point. I have seen politicians do this so many times. They will call for these medical camps, invite doctors, but of course, they know people would want to be treated. But the main point is that maybe they are coming to request for votes. That's indirect messaging, and also no message. We could also adopt that strategy where we delay communication until all pertinent facts are gathered. Sometimes we would be rushing to give out some communication, and we mess around. So what is our main point? We need to gather information before we send any out. That's very very important to be able to note. Sub functions of corporate communication in healthcare. Some of the things that we need to do: crafting healthcare corporate image and identity. We also need to managing corporate advertising within the health sector. So we know how to go ahead with our advertising. We could also be handling marketing communications in healthcare. So we make sure we do it well and correctly. And crisis communication, we have mentioned this so many other times. So we need to ensure we are doing this communication, like I said, to prepare people for crisis or tell them what you are doing to avoid that kind of crisis, and so on and so forth. And then navigating media relations in the healthcare industry. I have emphasized on how we are going to create media relations. We can do this through media interviews. We can do this through press releases. We can do this through social media interactions. And finally, we need to manage investor relations in healthcare. So we could be having people that have put money into the organization. We need to manage them, create a relationship with them, continually inform them what is happening within the organization. And also we could facilitate internal communication within healthcare systems. So within organizations, like we said, part of the stakeholders are employees. So we cannot be doing corporate communication to the outside world, and internally we are not getting it right. And also we need to engage in government relations with the regulatory bodies within the health sector. We cannot afford to leave the government out. So are we in good books with the government in terms of the services and the goods that we are offering? You could be running a health facility and you do not have the relevant approvals. At some point, you know, you might be caught. So to be on the safe side, we need to create a relationship with the government. And creating a relationship with the government is ensuring that you are in their good books. If it is any taxes to be paid, you are paying. If it is any licenses to be paid, you are updated on that particular front. And finally, we need to promote corporate social responsibility within the healthcare domain. This is also what we mentioned. We called it CSR. So it's all about you participating in activities of giving back to the society. That's also an avenue for you to communicate because the people are going to be present. They are going to be to come to the event. So you take that opportunity to be able to communicate a number of issues. We have what we call the forms of healthcare and corporate communication. Uh, the primary healthcare communication, where this one is focused on the core aspects of healthcare. So this is a main part in corporate communication. When we talk about something being primary, it is core, it is main. And to some extent, when it comes to primary aspects, sometimes we may not deal without them. So when we are doing primary healthcare communication, then we'll focus on the core aspects, then also address healthcare management staff and practices. And we are pushing on emphasizing on different values. And also, finally, is we need to take into account the behavior exhibited by healthcare organizations. We need to learn also from other organizations how they are conducting their corporate communication aspects. Maybe there are aspects that we can be able to borrow. And then on the secondary front, it comprises of healthcare advertising initiatives. We can adopt quite a number of them based on our ability, based on the availability of resources. And also it involves public relation efforts that are tailored to the healthcare sector. And finally, we will, through the secondary healthcare form of promotion, we are going to be able to incorporate various marketing strategies that will be specific to a specific healthcare or a specific information that we intend to pass across. And finally, on the forms of healthcare corporate promotion communication, we need to do what we all practice what we call tertiary healthcare communication. In this one, word of mouth becomes key. We could send out information very fast through word of mouth. So it means tell your friend, tell your neighbor, tell your church members, and so on and so forth. And then we can also develop user-generated contents. In this kind of a content, individuals will be discussing and sharing experiences related to healthcare services. Remember, this content will also open up people's mind. If somebody is sharing about their cancer journey, their diabetes journey, what is likely to happen is this information, once it's sent out there, very many other people are going to learn one or two things. So tertiary healthcare communication is also very important. Actually, these are some of the basics that in the villages, in the remote areas, that we need to adopt. Because once we do this, we are able to have information rich public very fast. So that is going to bring us to the end of our discussion on corporate communication. This particular session, maybe somebody who has a comment or a question would be invited to say something. Okay, so we are going to meet in the next lecture. I wish you a nice evening.
Thank you. Have a good night.
Good night.